Dr.
Mm.
Chukwueke. Thank you so much for joining us today
Thank
at
you.
TNT Open Mind Insights.
Mm.
So happy that you're here.
I'm glad to be here.
You are someone that we want to talk to because you have like hands-on experience out
Hmm.
there with the patients, especially on patients that are on the resourced communities.
Mm-hmm.
So thanks again.
Thank you.
We're gonna chat a little bit, very casual.
Hmm.
But first, just for the people looking at this that don't know you,
Okay.
what drove you to this profession of healthcare? What was your inspiration, and where are you
Okay.
from too?
Well, I did my training outside of the United States. My training was mainly the British kind of education where we do basic sciences and clinical medicine, 6 years total.
Hmm.
And then after that, you have your community service here and then internship here. So roundabout, the whole educational process takes about 8 years. But by the sixth year, you're done with medical school.
Hmm.
And then after that, during my community service here outside the United States, I worked in underserved communities, especially in vulnerable communities where the patients, the people there did not have anything, and communicable diseases were very prevalent. So
Hmm.
I saw firsthand how people suffered. And living with them, and you can be somewhere and hear about things, but until you're in that same space, then you appreciate what people are going through.
Hmm.
So that was my first contact with public health issues, because then I worked then with the Department of Public Health in the university in the northern part of the country at the time.
Hmm.
So that inspired me to move ahead to get a master's degree in public health. That was how I came to the United States. I had a master's degree in public health, focusing on global health.
Hmm.
And after that, I pursued a doctorate in public health, looking at chronic diseases, specializing specifically with preventive care.
Amazing.
So it was during that process I got into residency for family medicine and concurrently running the program, taking time off when I was able to from the doctoral program and concentrating on residency. It
Hmm.
was after I completed residency that I now completed the doctorate. Um, and also, since then, I've been working in underserved communities, different places, and it's amazing to see how under-resourced communities suffer.
Hmm.
Access to healthcare, resources not available, and even when there are clinicians there, it's not still enough to address the concerns of those underserved communities. Um, I later went on to have get board certified in lifestyle medicine,
Hmm.
and then recently completed an addiction medicine training for primary care providers. And it's a blessing to be here today to talk about
To talk about
my
it.
experiences. And my whole approach is to empower my patients to pursue and get whole health, um, and to live longer, healthier lives through a holistic approach.
That's
So
amazing.
that's just my whole goal.
What drove you to what inspires you around that topic, the holistic approach?
So you cannot dissociate a particular part of medicine from the other. We know
Hmm.
that health, in and of itself, defined as a state of complete physical,
Hmm.
mental, and social well being. Some people have thrown in spiritual well being because you cannot deal with one part and forget the other part, which is sometimes lacking, which the mental health plays a huge role in how the patients get to take care of themselves. If the brain is not functioning, everything falls through the crack. And we're just going to go round and round and round the cycle without getting any health outcomes for the patients. So,
Yeah, is that one of the barriers that you see right now in the resource community, like the fact that that disconnection, and what are some of the causes for that?
so I would say reflecting,
Hmm.
the mental health issue is a big one.
Hmm.
And primary care providers don't really have the training to address mental health. For me, I would say that when my patients came to me
Hmm.
with mental health issues, of course, I'm the first point of contact, but when I take a social history from them, and there's the issue of drug use or abuse or substance use, I see their pain, but I can't do anything. So what do? I refer to an addiction medicine specialist. Now, reflecting, there's a huge gap in treating mental health issues. Now, if they don't get into addiction medicine specialist, everything falls through the crack. So we're going round and round the cycle. And it's so difficult to get in because there are so few addiction specialists in this country. There are about 3,000 addiction specialists. 1,800 of them are addiction medicine specialists and 1,200 addiction psychiatrists. Now, look at some of the statistics. 48.2 million Americans meet the criteria for substance use disorder. 27.9 million Americans meet the diagnosis for alcohol use disorder. And 28.2 million Americans meet the criteria for drug use.
Huge disproportion.
So where are they going to go to? So there is a big, big problem. And so this program was a blessing because empowering primary care providers to fill in this gap, to be able to meet this demand. I will call it an epidemic and a public health issue and concern, because we know tobacco smoking decimates 500,000 lives per year in the United States, and we're not even dealing with that. But that is a big problem. And even when if I'm a secondhand smoker where somebody's smoking and I'm inhaling it, it increases my risk for death. In fact, 50,000 deaths per year from secondhand smoking. So these things are huge. And how can we help? What can we do to help? And so it's a blessing that this program came to help bridge this gap so that we can do something. And then in the meantime, and if in recalcitrant cases where we can't get them to quit or reduce harm, then we get them to the specialist, but at least to do something. And I think that's where, reflecting now, there was a lot of lost opportunity to have intervened at the time, just because I didn't have the resources, just because I didn't really understand the neurobiology of addiction. And so that was my experience at the time.
Yeah, and just like you, there are a lot of physicians and family practitioners that don't have that, that are still kind of going with the, this is what I do, and they're presented with those opportunities, but they don't have the training, so they can't address it
That's
properly
right.
or timely.
Yes.
And then that in its own thing can cause a whole lot of problems, because if people don't get the treatment they need right away, or they have to wait
They
months
have
to
to wait
get it,
months.
then it's just another tragedy,
That's
waiting to
right.
happen.
That's right.
What inspired you to get that certification, and what gap do you think? I know you talked a little bit about it, but what gap did it close for you?
So what inspired me? It was a colleague that just said, why don't you do this? That was just, why don't you go for this program? It's really, really good. I'm like, addiction, that kind of expression. Okay, I'm just gonna go. I'll just do it. I think it's important. Didn't really place too much on it. I said, I'll just go. But after the first conference, I was like, this is a blessing. I'm glad I applied, and thank you to UCI for the scholarship, because I got the scholarship to attend the whole program. And so I that was again the colleague that inspired me to come, and then it has helped a lot because now I understand. Because if I don't understand, if I don't know, then I can't be looking for something I don't know.
Right.
So now I know. Now I know when a patient comes, just not, oh, I drink alcohol, just a little bit. Well, we want to qualify what are the amounts, because a lot of people are drinking and they don't know they're heavy drinkers. So let's qualify what you're drinking. And they now know. We now talk about alcohol being a carcinogen, meaning cancer causing. And they, oh, I never knew that. You're concerned as a female for breast cancer. Do you know it causes breast cancer? Oh, I never knew that. You know,
Mhm.
we know 1 in 8 women will have breast cancer. We want to do what we can do to prevent it and not add something. So people are knowing now that these things cause problems for them.
Mhm.
And when they read it, I get my patients to read it with me from CDC, and they're like, I didn't know that, you know, and they
Mhm.
just, you know,
I mean,
they,
yeah, you get the opposite side of it
yes,
from the advertisement,
yeah,
right? You get
yeah, the
the
hiccup
this
and
is good for you, keep doing it, you know, oh, socialize, da da
yeah.
da. But nobody looks at it. You know, there's two
Yeah,
sides of the
there's two
story.
sides of nobody's telling any, and when they're reading it, they just stop, hiccup, and like, what did I just read? And I'm like, yes, that's what it is. And it gives them the opportunity to now reflect, think, and then you use the motivational interviewing to get them from where they are to the next stage. And we start that process of, are you open to treatment? Because this is what it would do for you. I can help. I'm no
Mhm.
longer the person like, okay, I'm just going to send you. Of course, I was
Mm.
empathetic, but now I'm compassionate because I have the resources, the tools to now do something and
Yeah,
not just sit back and send away to
yeah,
the addiction medicine specialist.
that's amazing. I've seen it as a, you know, the 80-20 rule. Are you
Mhm.
familiar with the 80-20 rule?
Yeah.
80% of the results are
Hmm.
caused by 20% of the issues, right?
Yes,
So this is kind
yes.
of like the 20%
Yeah. Hmm.
that causes 80% of the problems, you
Hmm.
know. And I think I see you know what I'm saying? It's like you getting this knowledge, this training, it will probably tackle 80%
The
of the issues we're
issues
having because you're capturing them like
as,
faster.
as the first point of contact with any
Yeah.
healthcare institution. Yeah.
What do you do to I mean, you have a network. Everybody has a network. So what do you do to like to to are you currently like training other physicians? Do you talk to them about it? Like, how does that work exactly?
So
Like,
most of my colleagues that where I work, I did tell them I was going through the training, and they were like, "Oh, we're going to send our patients to you. You know, we're going to send. Oh, that's very good. At least we don't have to ship them out to addiction and wait for when they get it. We're like, we're going to
hmm
refer the patients to you. But I get to talk. You know, that it's important we screen those little things because if we don't screen them at that moment, they are lost. So I haven't actively started training, but I'm talking about it
hmm
in our little space, you know, they do this,
hmm
and screen more because, again, I go back to what I said before. If I don't know what I'm looking for, what am I
hmm
screening for?
yeah,
Even for a well child visit, I now have the tools, those screening questionnaires
yeah,
to screen them because even as young as 9-year-olds are using cannabis.
yeah.
You know, I have people who started using alcohol at the age of 12.
hmm
So the opportunity to be able to use those screening questionnaires to actually dig more helps me help them better.
Yeah, and
Hmm.
it's probably sustainable because you capture that up front, right? And
Hmm.
then you have less illness
Hmm.
eventually that you
But
have to
that's
treat,
right.
right? So you kind of preventing some stuff
Hmm.
that eventually they will come to you for,
That's right.
you know. So
And of course, those eventually will lead to mental health problems. The
right.
younger they are with substance use, the more mental health problems in down the line, and very difficult to get them off those substances because they become more addictive at a very young age, and the young
hmm
brain that's very vulnerable to all these substances. So at that stage, it makes them more vulnerable and they stay quite addicted, for lack of better description,
hmm
and very difficult to even get them out. So it's good to start. They say prevention is always better than cure.
Yes,
So
absolutely.
always start and know what you're looking for. And I think that was what this program gave me, you know, all those questionnaires, what to look for, how to ask those questions, how to open them, you know, open those conversations. Sometimes when the medical students asked, they said, "Oh, but they didn't tell me that." But
I was
when
gonna
I
ask
get,
you that. Like,
yeah.
how is it? Like, how does these? Okay, medical school. What you
Mhm,
said? You had 8 years.
mhm.
8 years.
6.
6 years.
Mhm, mm.
And then residency was how many years?
Residency 3 years.
3 years.
Mhm,
So that's 9 years in total.
mhm, mhm. But remember, I did my residency in the United States.
Oh, okay,
Yeah.
gotcha.
Mhm,
Okay.
mm,
So yeah, so all those years,
mhm,
right?
mm,
It's just interesting to me that something so powerful like prevention, you
mhm,
know, and the feedback I get, right, from colleagues, you know, I'm not a doctor, but I get like very little on that
mhm.
in your like what was your experience with that?
Prevention wasn't the thing that was talked about. I mean, now it's now a huge issue because we know that prevention is better than cure. So, but then it was just treat without dealing with the root cause of the problem. You know, people will still take medications. There's no way we're going to get rid of those medications. But are there things we can do that can deal with the root cause, even just decreasing the number of medications they take for something that is totally preventable?
So you can identify what the
Yes,
variables and the root
exactly.
cause, yeah.
And being board certified in lifestyle medicine, that's what it does, digging to the root cause of the problem. So we know how to tackle it, not just putting a band-aid on a
I
wound,
love that.
but how can we help?
Yeah,
So,
yeah. I'm an engineer by profession, so every time you talk about removing the root cause, it's like, yes, that's exactly what we need to do, you know. And I love that they're doing that with this program, and it's interesting to me how something so small in scale, right? Like I think that the program is tackling a lot of issues that eventually you don't see the benefits like right away, but it will create a huge
That's right.
impact, you
That's
know.
right. And people dealing with substance use and abuse have chronic illnesses too. So if you're going to deal with the diabetes, high blood pressure, obesity, you need a healthy brain to be able to tackle those things. But if the brain is not healthy,
Right.
those conditions, the diabetes will not get controlled. They're not going to follow through on their medications.
Yeah.
And so that cycle continues. So that
Yeah.
intersection is very important, making sure that we use the lifestyle medicine aspect and to address the chronic conditions and also tackle the mental health issues and the substance use and drug abuse.
As a whole. So
Yeah.
you kind of like the primary care physician. I think a lot of people have this thing that okay, you just go there for checkups, or you just go there for blood work, and you just go
Yes.
there. So this is kind of like you're expanding your reach
Yes.
to
Absolutely.
tackle some of the important issues that will make 80% of the difference, especially in future
That's
care,
right. That's
right?
right. That's right. Even with opioid use, it's a big problem.
Mm-hmm.
And talking about your 80-20 rule, United States occupies 20% of the world's population, but
Yep.
we consume 80% of the
Totally.
world's
Oh,
opioid.
yeah, I don't know if that's allowed to say totally, but like
80% of the world's opioid.
I just
And
said
so,
totally. I'm
so
in
it's,
California,
it's
right?
an epidemic, and
Yeah.
people are just, we know the consequences of opioid addiction. So it's huge.
So
And
there's a need,
there's a
definitely a need.
huge, huge, huge need. And again, going through this program and looking at the statistics, it was like a wow, we need help. And
Yeah.
this program has created the opportunity for that help.
Yeah. I love
Yeah,
that it's changing the landscape from treating to preventing.
that's right.
Slowly but surely. Um, I think we're used to we're used to fast. The microwave
Right
society, fast,
away,
fast, fast,
we want it
fast, right?
now.
So we do
Yeah.
everything that will
Hmm.
return fast, something fast, and then we forget about the future
Hmm.
and how important that is. So I think that's reversing that
That
mentality, you
mentality,
know.
yeah. Because you can't use the acute disease model for a chronic disease model. It doesn't work that way.
Hmm.
If we have an infection, we take antibiotics,
Right.
we take antivirals. But for chronic diseases, it's not that simple.
Hmm.
It's you have to follow it. It has to be consistent, persistent, and lifetime. So
Hmm.
we can't use like your word microwave chronic diseases. It doesn't work that way. We have
Hmm.
to learn to do things right, eat healthy, exercise, sleep
Hmm.
well, avoid risky substances, and have social connections. Very, very
Yes.
important. Building communities and
Yes.
safe communities. Very, very important for
Yeah.
all total health and well-being.
Yeah, I
Yeah.
heard something, and I want your thoughts on this.
Hmm.
I think I read it somewhere or something, but it says that one of the causes of addiction is isolation and lack of
Mm.
connection. What are your thoughts on that? I
That's
think
right.
I
One
want I
of
want
the
to pick on that. Yeah,
Yes, I mean not that's not the only, but that is one.
one.
Because remember, when we take these substances, it hijacks the brain. It
Mm,
hijacks your frontal lobe, and the dopamine that is released is just way above what is expected from a normal brain. So normally when we eat, when we socialize, we're happy, right? We
mm-hmm,
want to do that when we sing, when we, those kinds of
mm,
good things. But when we engage in taking these substances, it throws the dopamine to a different level. And so it takes away that pleasure that would normally, for a normal healthy
Just
brain,
from
say,
talking, yeah,
yeah, just from talking, hanging out.
connecting.
And so that dopamine, so that feeling, the brain remembers that's a very high feeling. I want to continue doing that. And so it takes away from the social, your ability to eat well, all those things, because the brain has been hijacked.
Mhm.
You're not able to make decisions any longer, right decisions, executive function is depleted. All you want to do is go back to that thing that keeps your pleasure at high levels more
Mhm.
than what is normal. And so it's, yeah, and of course,
Yeah.
when you start doing that, you want to socially
Social.
isolate yourself
Yeah.
from people because that doesn't give you pleasure. You just want to do what you want to do.
Which in returns will affect your lifestyle, your health,
Everything
your
else.
ability to make decisions,
Mm-hmm.
to the right decisions for family, for
Mm-hmm.
work,
Mm-hmm.
which creates a whole new
Yeah, of course,
wave of.
with that isolation, of course, mood disorders, all
Mhm.
those kinds of things. So, yeah, that's one of them. Yeah, absolutely.
Yeah.
Social connectedness, when it's lost, it's a huge
So
problem.
it's important to treat addiction.
Yes,
I love
absolutely.
that. And
Absolutely. Absolutely. And it's a big problem.
yeah, I
And
can tell you from experience, like I have a glass or two of wine and I'm completely numb the next day. I can't function properly.
mm.
So, after I got older, I completely kind of, stay away from that because I can feel the just you're not the same. Like you don't
Mm-hmm.
make your mind is not sharp.
Mm-hmm.
So when you go to your doctor for a regular checkup, and maybe that's one of the things that is affecting your life the most,
Mm-hmm.
and you just go for a checkup.
That's right.
If it's not identified, then it's a ripple effect,
That's right.
So
That's right. So now with every patient that comes, even when if they come for something else, I try to get into their social history.
yeah.
There's a way I have to maneuver and get into their social history. I had a
Hmm.
patient who came in for a hand injury, totally
Unrelated.
opposite,
Hmm.
unrelated to her addiction issue. She never even brought it up, but I started digging, and then we got into drinking
Ah,
and how drinking can impact her health, her healing, and everything. And that took a different spin on our interaction. And
wow,
I got her to get to addiction. I started the treatment. She was very happy and
amazing.
grateful. In fact, the hand thing became secondary, and I said you will have to go to addiction, but in the meantime, this is what I want you to do.
Hmm.
I want you to return. I want you to, so that we can talk about this. And she
Hmm.
did, and we started her on some medications for alcohol abuse. And a total spin from just
From
hand
just a
injury.
broken
Yeah, it
hand,
was
you
just a
cannot
broken.
change the
The whole
holistically,
this whole
right?
story changed,
Yeah.
and she was very, very grateful for that. Even the hand was very important because we need her hand to be functioning. But it was just the way we got, the spin of the
Hmm.
conversation, and then we got to know about her addiction history, how she, trauma when she was little, how
Hmm.
she got into drinking alcohol. She's losing her husband, she's losing her, even it's
Look
gotten
at
worse.
that. Yeah.
So everything just came out in that short encounter. In short, an encounter that should have taken 15 minutes took us about almost 35 minutes.
Hmm.
And
That's what I
so,
was going to say. So even if you have 15 minutes, which is a challenge
mm-hmm,
that
mm-hmm,
most doctors I'm hearing,
mm-hmm,
even if you have those 15 minutes, right?
mm-hmm,
If you focus instead of treating, right, in those 15 minutes, if you like you did, right, if you actually dig into let's talk about this, let's
mm-hmm,
dig a little bit deeper.
mm-hmm.
And those 15 minutes are used for that. Maybe the next time, because you already tackled some of the issues, is less time and it's
Yes,
less
less
time, right?
time. That's right.
So
That's right.
like again, focusing on
Mm-hmm.
on preventing versus treating.
Yes.
So how is she doing now?
She did commit that she was going to go to the addiction specialist, but we had
Amazing.
already started her on the medication, and she was, at the time she returned, prior to, after we now no longer see her. I
Hmm.
no longer see her. She was very grateful.
Yeah.
Yeah. And there was a
Yeah.
significant family history of alcohol abuse. Her father,
Hmm.
her mother, her siblings, everybody. Yeah. So that was
I
a big
love
burn.
that
Yeah.
story.
Mm,
I
mm,
love that story a
mm,
lot because it shows kind of like the power of, from experience.
mm,
It's a very refreshing when you go to a doctor,
mm,
And I think we all have done it. We all have gone to the doctor, and we feel like we're like in a factory, right? Versus when you go, like I just moved to, I moved to a different state 4 years ago, and when you move, you have to pick up a new doctor, and you for everybody, and you have to go through like it takes forever to get a primary
It
care
does.
physician
It
now.
does. It does.
So when you finally do, right, it's refreshing to get someone that actually says, how you doing. I think it creates a lot of value.
It
Yeah, for
does.
patients.
It does. It does because it's helping the community. It's helping people. The problem is huge. It's
Yeah.
just that it's not shouted everywhere.
Yeah.
But it's huge. When you look at those statistics on paper, it is huge. And I think it's even underreported because even myself tracking the patients that I saw from the day we started this program, I started tracking people with drug use, abuse, even past history.
Yeah.
Just in looking at their problem list, it was huge. I identified like 2 every single day. So 2 since the month of March, every single day.
2 out of
5
24
days a
average.
week for 12 months.
Yeah.
That is me tracking.
That's like, okay, I don't want to do
Don't
my
do the
head, but
math.
it's 2 for all, like
2
that's a lot
times
of people.
7, 14 times 30 days, multiply that by 12.
That's how many
That's
lives you're
me.
impacting.
Yeah, that's me seeing those people, learning about that these people had this thing in the past.
Gotcha.
And they lost opportunity because it wasn't something I was looking for. And that was just me counting. Just imagine if every other person was
All the
doing that.
physicians.
So I think it's underreported. I think it's huge, more than just what we have on paper. And but again, like I said, this was an eye opener and very helpful for physicians, especially primary care providers, and also for the community that we're seeing.
What would be something, like from your perspective, what would be something that if you had it your way, if you had a magic wand, and if you like the world could be, the way you see it, what would be your hope?
I'm hoping that this program will continue and continue to train primary care providers so that they can be the hands and feet to address this epidemic. You people's mantra is empowering clinicians and strengthening communities. And so if you don't empower clinicians, how does our community get strong? So we need this program to continue. Like I said, it's been a blessing for me. And even coming from a place of faith, we know in our religious institutions, people are dealing with this. We know drug substance use is highly stigmatized. So it has put me in a place of where I can, in my own religious institution, say, you know what, I see you, I hear you, and I'm here to help. You don't have to walk this path alone. And it's just a blessing because people are struggling. People are dying because it's highly stigmatized. And how can we help? So if I didn't know about this, I'll just, go about my business.
You can't see them.
Yes, I can't see them. I can't even understand what is going on in the brain. But now I know, I have this knowledge, what is happening to this brain that's been hijacked by these substances and weakens the ability for this individual to do what is right. And so I have to help. And so that's been if there's nothing else that has happened to me, that was a huge blessing because now I can say, you're heard. You don't have to be alone. We see you and there is hope and there is help. You're not stigmatized. Something is happening to you and we can help.
Yeah. And little by little, you get to decrease that huge statistic.
Yeah, one by one, little by little, with every clinician that is here today. Because like I think somebody told me here when I came in today that the number of people has exploded from last year when we started. And that's good. It's going to really help bridge that gap.
Yes, I mean, like 2 a day and for a whole year, and that's only you.
I was counting. Counting. They had either the current or past use.
Past issues,
Excuse me, in remission. But either way, that's the number.
Yeah. And from a patient's perspective, right? From a patient's perspective, I feel like it's going to change the way we see our primary care. like for me personally, I don't, this doesn't reflect anyone's, you know, opinion, but personally, right? Um, I get to see a physician that they're not just doing a checkbox, you know, and they're
Checkbox.
like coming in and out, and I get to see someone that is actually interested in what
Mm-hmm.
happens, and identifying if someone does have an addiction problem.
Mm-hmm.
Sometimes they're afraid because of the stigma to talk
Mm-hmm.
about it,
That's right.
and encountering someone that actually sees you and say, let's talk about
Let's
this,
talk
is
about
in
this.
in a place that's safe,
That's
right?
safe, yeah.
It
Mm-hmm.
makes a difference for people,
That's right. That's right. That's
so
right.
from a patient's perspective, I feel like it's going to improve tremendously the relationships,
That's right.
whomever. If I see a trained physician versus someone that still has the blinds
Mm-hmm.
on, right? I think that those patients are gonna be lucky.
That's right.
They're gonna be
That's
lucky.
right. Yeah.
Yeah,
Yeah. And then since then, I've been having those conversations with them, and it's always rewarding to see them, Doctor, you helped me. Thank you.
totally right.
So
Yeah.
it brings that fulfillment, personal fulfillment that you did something
Mm-hmm.
and made a difference.
Mm-hmm.
Yeah. But
Exactly.
that's because I got the tool, I got the
Now,
resources
yeah.
to make that difference. Not that there wasn't making any, but this was just a, a bummer to
Mm-hmm.
the
A
whole
bonus.
thing,
Yeah.
and bonus to the whole thing, to give that holistic health, mental disorders, very, very important
Yeah.
for health.
Absolutely. I love that. Anything else you would like to share as part of insights? Any wisdom you would like to share to new fellows or to the public in general?
Well, like I said, I pray this program continues,
Hmm.
because we really need a lot of um, this training for primary care providers, because the gap is huge. There's no way 3,000 specialists can take care of this huge problem.
Hmm.
So we need help. And so wherever this grant is coming from, wherever it's coming from, please continue to provide the grants for primary care
The
providers, because
support,
it
yeah.
continue to provide this
Yeah.
support. That's my request and wish that it will continue, because this again has been a blessing to me personally.
Yeah, it's an investment. I mean, like
Mm.
we can talk about this all day, but anyone that invests in prevention, that's the new, like, invest in prevention. You'll get your return on investment. Maybe not next year, but eventually your kids will have the return on
That's
investment.
right.
And
That's right. That's right.
so it,
Building a safer community, a safer place for our kids to grow
right,
and thrive, and
exactly.
be free from, because again, young people are not immune. 1 in 8 high school
Yeah.
student has a substance use disorder. That's when I first heard that from one of the lectures, I was blown away.
Hmm.
So, yeah, keeping our children safe.
Yeah. So
Yeah.
I was gonna say that. So I thank you because I
Mhm.
have a 5-year-old, and I know that some people watching here have kids, and I want to invest in preventing. I want her to grow in a community that
Sure.
addiction was kind of like history, right?
Mm-hmm.
And I think the work that you guys are doing is supporting that mission and that vision. So,
That's right.
so thanks again.
Thank you. Thank you. It's a pleasure to be here.
Thank you.
Thank
Mm.
you.